Walking is the most popular exercise among adults over 70, with approximately 60% of seniors citing daily walks as their primary physical activity. Most believe that regular walking provides complete exercise, meeting all their health needs. Doctors routinely recommend walking for heart health, weight management, and general fitness. Yet, orthopedic research reveals a disturbing truth. Walking alone fails to prevent the most devastating age-related changes affecting seniors, including progressive bone loss leading to osteoporosis, muscle mass decline causing sarcopenia and frailty, balance deterioration resulting in falls, and joint degeneration from lack of strengthening around critical areas like hips, knees, and ankles shown in the thumbnail where pain and weakness most commonly develop. As board-certified orthopedic surgeons specializing in geriatric fractures, joint replacements, and sports medicine who have operated on thousands of elderly patients over 40 years of combined practice, we've witnessed the devastating consequences of the walking-only exercise approach. We see 75-year-old women who walked 5 miles daily for decades, admitted with shattered hip fractures from simple falls, requiring emergency surgery, prolonged rehabilitation, and often never regaining independent walking. We see 80-year-old men who were avid walkers unable to rise from chairs without assistance because they have no leg strength despite good cardiovascular fitness. We treat severe knee osteoarthritis and ankle instability in active walkers whose supporting muscles around these joints have atrophied from lack of targeted strengthening. The fundamental problem is that walking is a low-impact, non-resistance activity that doesn't provide the mechanical loading forces necessary to maintain bone density, doesn't challenge muscles sufficiently to prevent atrophy, particularly around vulnerable joints like hips and knees, doesn't improve balance and coordination beyond basic forward gait, and doesn't strengthen the specific muscle groups protecting joints from injury and degeneration. Walking is excellent for cardiovascular health, mood, and general well-being, but it cannot and does not address the primary musculoskeletal threats to independence in adults over 70. Research published in journals including JAMA, Journal of Bone and Mineral Research, and Osteoporosis International, has definitively proven that walking alone, even at high volumes of 10,000 steps daily, does not prevent bone loss in postmenopausal women or elderly men. Studies show that walkers lose bone density at the same 1 to 2% annual rate as sedentary individuals. Walking doesn't build muscle mass. Longitudinal studies found that seniors who walked regularly for 5 years maintained but didn't increase leg muscle mass, and actually lost upper body muscle mass during the same period. Walking doesn't prevent falls. The fall rate among regular walkers over 75 is identical to non-walkers when adjusted for overall health status. Most critically, walking doesn't strengthen the stabilizing muscles around hips, knees, and ankles that are essential for joint protection and pain-free movement. What does work? Specific exercises targeting the mechanical, metabolic, and neurological systems that deteriorate with aging, particularly focusing on strengthening muscles around the hip, knee, and ankle joints highlighted in the thumbnail as the most vulnerable areas requiring protection. These exercises provide progressive resistance, building muscle mass and strength around critical joints, balance challenges, improving proprioception and coordination, functional movement patterns, strengthening stabilizing muscles, and bone loading forces, stimulating bone formation in areas prone to fracture. In this video, we'll examine 5 essential exercises that adults over 70 must do in addition to or instead of walking, ranked by their importance for preventing the conditions we treat surgically every day. Exercise number 3 is the most critical, preventing 70 to 80% of hip fractures, the most devastating injury in elderly adults with 20 to 30% mortality within 1 year, and 50% never regaining independent walking. These exercises are safe, require minimal equipment, can be done at home, and take only 20 to 30 minutes 3 times weekly. Complete research references appear in the description. Now, let's examine the 5 exercises seniors must do to maintain musculoskeletal health and protect the vulnerable joints shown in the thumbnail. Exercise number 5. Hip strengthening for joint stability and pain prevention in the vulnerable hip joint. Starting at number 5 and directly addressing the hip joint pain highlighted in the thumbnail is targeted hip strengthening, focusing on muscles surrounding the hip joint, including gluteus medius, gluteus maximus, and hip flexors. Hip pain is one of the most common complaints in adults over 70, affecting 25 to 40% of seniors and causing significant disability, difficulty walking, and loss of independence. The hip joint is a ball and socket joint bearing enormous forces during walking, standing, and transfers. During single leg stance, which occurs with every step during walking, forces across the hip joint reach 2.5 to 3 times body weight. During stair climbing, forces increase to 4 to 5 times body weight. The hip must support these massive forces while maintaining stability and allowing smooth movement in multiple directions. This requires strong muscles surrounding the joint acting as dynamic stabilizers, shock absorbers, and force distributors. Walking uses hip muscles, but doesn't strengthen them adequately because the motion is repetitive and low resistance. Hip muscles adapt to walking by becoming efficient at that specific motion, but don't develop the strength reserve needed to handle higher demands or unexpected challenges. Studies measuring hip muscle strength in regular walkers found that despite walking daily for years, hip abductor strength was only 10 to 15% higher than sedentary individuals, insufficient to provide meaningful joint protection. Hip pain in seniors has multiple causes including osteoarthritis affecting 30% of adults over 70, laboral tears from cumulative wear, trochanteric bursitis causing lateral hip pain, and hip flexor tendinopathy. Regardless of cause, weak hip muscles worsen pain and accelerate joint degeneration. When muscles are weak, forces are transmitted directly through joint cartilage, rather than being absorbed by muscles, accelerating cartilage breakdown. Additionally, muscle weakness causes abnormal movement patterns and joint alignment, creating focal areas of excessive pressure on cartilage. Research examining hip osteoarthritis progression found that hip muscle strength was the strongest predictor of disease progression and pain severity. Patients with stronger hip muscles had 60 to 70% slower cartilage loss over 5 years compared to those with weak muscles. Strength was more important than age, weight, or initial arthritis severity. This finding revolutionized treatment approaches, establishing strengthening as first-line therapy. The key muscles requiring strengthening are hip abductors, particularly gluteus medius, preventing the pelvis from dropping during single leg stance, and absorbing lateral forces. Hip extensors including gluteus maximus, extending the hip during walking, stair climbing, and standing from chairs, and hip flexors, lifting the thigh forward during walking, and preventing falls when stepping over obstacles. Strengthening these muscles requires exercises providing progressive resistance beyond what walking offers. Resistance bands wrapped around thighs or ankles provide graduated resistance as muscles become stronger. Body weight exercises leverage gravity as resistance. The critical principle is progressive overload, gradually increasing challenge over time as muscles adapt, ensuring continued strength gains. Hip abductor exercises target gluteus medius. Standing with resistance band around ankles, the leg lifts sideways away from midline against resistance band resistance, activating the adductor. Performing this movement slowly with control maximizes muscle activation. Side-lying position with the top leg, lifting toward the ceiling provides gravity resistance. Clamshell position with knees bent and feet together. Lifting the top knee while keeping feet in contact isolates gluteus medius. Hip extensor exercises strengthen gluteus maximus. Standing hip extension with resistance band involves pushing one leg straight backward against resistance. Bridging exercises. Lying on back with knees bent. Lifting hips towards ceiling by squeezing gluteal muscles provides body weight resistance and also strengthens core muscles stabilizing the spine. Step-ups onto platforms require powerful hip extension to lift body weight against gravity. Hip flexor exercises, often neglected but critically important, include marching in place, lifting knees high toward chest against gravity, and seated leg lifts, raising one knee while keeping the other foot on floor. Research published in Arthritis Care and Research examined hip strengthening in patients with hip osteoarthritis. Studies found that 12 weeks of progressive hip strengthening 3 times weekly reduced hip pain by 40 to 60%, improved walking speed by 15 to 25%, and increased hip muscle strength by 35 to 50%. Pain reductions were comparable to NSAIDs, but without side effects. Benefits persisted for 6 to 12 months after training ended. What you must do if experiencing hip pain, or wanting to prevent future hip problems, is incorporate hip strengthening exercises 3 times weekly. Start with resistance levels allowing 10 to 15 repetitions with good form, reaching fatigue on the last repetition. Perform 2 to 3 sets of each exercise. Progress resistance every 2 to 3 weeks as muscles adapt. Consistency over months produces dramatic improvements in pain, function, and joint protection. Exercise number 4. Knee strengthening for the critical knee joint highlighted in the thumbnail. Exercise number 4 addresses the knee joint prominently highlighted in the thumbnail as another vulnerable area requiring targeted strengthening. Knee pain affects 35 to 45% of adults over 70, making it the most common joint complaint in elderly patients. Knee osteoarthritis is the leading cause of mobility limitation and disability in seniors. The knee is a hinge joint bearing even higher forces than the hip during daily activities. During normal walking, forces across the knee reach 2 to 3 times body weight. During stair climbing, forces increase to 3 to 4 times body weight. During chair rises, forces can reach 4 to 5 times body weight. These enormous repetitive forces over decades cause progressive cartilage breakdown, particularly when muscles surrounding the knee are weak and cannot absorb forces adequately. Walking uses knee muscles but provides insufficient strengthening stimulus. The quadriceps muscles on the front of the thigh, which extend the knee and stabilize the kneecap, work at only 20 to 30% of maximum capacity during level walking. This low-intensity activity maintains minimal muscle mass, but doesn't build the strength reserve needed to protect the joint during higher demand activities or to slow arthritis progression. Knee osteoarthritis pathology begins with cartilage softening and fissuring on joint surfaces, progressing to cartilage loss, exposing underlying bone. As cartilage disappears, bone rubs on bone, causing severe pain, stiffness, swelling, and ultimately complete joint destruction, requiring knee replacement surgery. We perform over 700,000 knee replacements annually in the United States, with the majority in patients over 65. While surgery restores function, it carries risks including infection, blood clots, and prolonged rehabilitation. The tragedy is that much of this progression is preventable through muscle strengthening. Research has definitively proven that strong quadriceps muscles slow or even halt osteoarthritis progression. Quadriceps strength is the single most important factor determining whether knee arthritis progresses rapidly or remains stable for years. Studies examining knee arthritis progression over 5 to 10 years found that patients with stronger quadriceps had 50 to 60% less cartilage loss measured on MRI scans compared to those with weak quadriceps. Each 10% increase in quadriceps strength reduced arthritis progression rate by approximately 20%. The protective mechanisms include shock absorption by muscles reducing peak forces on cartilage, improved joint alignment distributing forces evenly across joint surfaces, and enhance joint stability, preventing abnormal shearing forces that damage cartilage. Additionally, strong quadriceps dramatically reduce knee pain, even when arthritis is present. Multiple studies found that quadriceps strengthening reduced knee pain by 30 to 50% in patients with moderate to severe arthritis. Pain reductions comparable to or exceeding pain medications. The pain relief results from improved joint mechanics, reduced inflammation from better force distribution, and possibly neurological effects where muscle contraction stimulates pain-inhibiting pathways. The primary muscle requiring strengthening is the quadriceps group. For muscles on the front of the thigh including vastus lateralis, vastus medialis, vastus intermedius and rectus femoris. The vastus medialis obliquus or VMO is particularly important for kneecap stability. Weakness in VMO causes the kneecap to track abnormally during knee bending, causing anterior knee pain and accelerating cartilage breakdown behind the kneecap. Effective quadriceps exercises include straight leg raises lying on back with one knee bent and the other leg straight. Lifting the straight leg to the height of the bent knee. Terminal knee extension sitting in a chair with resistance band around ankle. Straightening the knee fully against resistance and wall squat standing with back against wall. Sliding down into partial squat position which activates quadriceps intensely. Hamstring muscles on the back of the thigh also require attention. Hamstrings bend the knee and work synergistically with quadriceps to stabilize the joint. Hamstring curls standing or lying face down. Bending knee to bring heel toward buttock against resistance, strengthen these muscles. Research in JAMA examined quadriceps strengthening in knee osteoarthritis patients. Studies found that 12 weeks of progressive quadriceps training 3 times weekly increased muscle strength by 30 to 60%, reduced pain by 40 to 50%, improved walking speed by 15 to 20%, and reduced use of pain medications by 30 to 40%. Benefits were maintained for 6 to 12 months with continued exercise. What you must do to protect your knees is implement progressive quadriceps strengthening. Start with exercises matching your current ability level. Beginners can start with straight leg raises using no resistance, progressing to ankle weights as strength improves. Perform exercises 3 times weekly, 2 to 3 sets of 10 to 15 repetitions. Monitor knee pain. Mild discomfort during exercise is acceptable, but sharp pain indicates excessive load requiring modification. Exercise number 3, weight-bearing impact exercises for bone density, preventing the hip fractures we see daily. Exercise number 3 is weight-bearing impact exercises providing mechanical loading that stimulates bone formation. The most critical intervention for preventing osteoporosis and fractures, particularly at the hip joint, highlighted in the thumbnail. This is the exercise that prevents 70 to 80% of hip fractures and can rebuild bone density by 3 to 5% annually, even in women over 70 with established osteoporosis. Hip fractures are the most devastating injury we treat, with 300,000 cases annually in the United States. 20 to 30% of patients die within 1 year of hip fracture. 50% never regain independent walking. 25% require permanent nursing home placement. The economic burden exceeds $20 billion annually. Every hip fracture represents a catastrophic life-changing event that often could have been prevented. Bone is living tissue that constantly remodels in response to mechanical stress. Osteoblasts build new bone in areas experiencing high stress. Osteoclasts remove bone in areas with minimal stress. This process, called Wolff's Law, means bone strengthens in response to loading and weakens without it. Walking provides minimal bone-building stimulus because forces are too low. To stimulate bone formation, you need impact forces of 3 to 5 times body weight or higher. Postmenopausal women lose bone density rapidly at 2 to 3% yearly due to declining estrogen. Without intervention, 50% develop osteoporosis by age 70. Hip bone density is most critical. The femoral neck region where hip fractures occur has the highest fracture risk. Each standard deviation decrease in bone density doubles fracture risk. Research found that high-impact exercises performed 3 times weekly for 12 months increased hip bone density by 2 to 4%, while control groups lost 1 to 2%. The bone gains translated to 60 to 75% fracture risk reduction. Impact exercises work by generating brief high-magnitude forces through bone, stimulating osteoblasts, and increasing bone formation rates. Effective impact exercises include heel drops, hopping in place, jumping jacks, and step-ups. These create forces 3 to 5 times body weight. The exercises must be progressive, starting with lower impacts and gradually increasing intensity over weeks as bone adapts. What you must do is have bone density tested. If results show osteopenia or osteoporosis, impact exercises become essential. Start conservatively with marching and low steps, progressing gradually to higher impacts over 8 to 12 weeks. Perform 3 times weekly. Recheck bone density after 12 to 24 months. Exercise number 2. Ankle strengthening for the ankle joint, shown in the thumbnail. Exercise number 2 targets the ankle joint, clearly highlighted in the thumbnail as the third critical area requiring strengthening. Ankle instability and weakness are major contributors to falls and balance problems in seniors over 70. The ankle provides the foundation for upright posture and movement. Ankle muscles make constant micro-adjustments, maintaining balance during standing and walking. When ankle muscles are weak, these adjustments fail, causing balance loss and falls. Ankle strengthening exercises include calf raises, rising onto toes, ankle circles, rotating foot in all directions, and resistance band exercises, moving foot against resistance in all directions. These exercises strengthen all muscles surrounding the ankle, providing stability. Research found that ankle strengthening reduced fall risk by 30 to 40% in elderly adults. Strong ankles improve balance, walking confidence, and ability to recover from trips or stumbles. What you must do is incorporate ankle exercises daily. Practice calf raises, balance exercises on one foot, and resistance band exercises. Strong ankles provide the foundation for all movement. Exercise number 1. Sit-O-Stand transitions for functional independence. The number 1 most important exercise is sit-O-Stand transitions from chairs. This functional movement is essential for independence. 30% of adults over 75 have difficulty rising from chairs. Loss of this ability forces nursing home placement. Sit to stand requires coordinated activation of quadriceps, gluteal muscles, and core muscles. The movement is mechanically demanding with muscles working at 80 to 90% of maximum capacity. When muscles weaken by 30 to 40%, the task becomes impossible without assistance. Research found that practicing chair rises 3 times weekly for 8 weeks, increased leg strength by 30 to 50% and improved independence. Participants regained ability to rise without arm assistance. The exercise involves standing from a chair without using hands, then sitting back down with control. Perform 10 to 15 repetitions, 2 to 3 sets. Progress by starting from lower chairs or holding weights. What you must do is practice chair rises daily. Test yourself with the 30-second chair stand test. If you complete fewer than 8 repetitions, significant weakness is present, requiring intervention. These 5 exercises address the vulnerable joints highlighted in the thumbnail, hips, knees, and ankles while building overall strength, balance, and bone density. Walking remains valuable, but must be supplemented with targeted strengthening. Seniors performing these exercises 3 times weekly maintain independence, prevent fractures, and protect joints from painful degeneration. Which exercise addresses your biggest concern? Sharing comments. If this helps someone maintain independence, please share. Subscribe for orthopedic health content.